Hi, I'm Dr. David Rowe from Rowe Chiropractic Offices, and today's topic is about the relationship between mental health, our general feeling of well-being, issues of anxiety or maybe even depression, and how it relates to chiropractic care. Now, since the beginning of chiropractic care, patients have always communicated that I get adjusted, I feel better. When you say I feel better, you mean there's less pain? Oh, that definitely. But no, I just have a better sense of ease. My general mood feels better. My emotions feel better. My energy feels better. I just feel more like I have a greater 𝗵𝗵𝗹𝗂𝗰𝗁. I just want to get going. Patients communicate that with us all the time. Chiropractic helps their overall outlook on life. How could that possibly be by changing posture that we'd get such a dramatic effect in terms of mood and general sense of well-being? Well, we know that every function of our body is controlled by the nervous system. And when I say every function, I literally mean every function. Yes, heartbeat. Yes, respiration. Yes, our immune system. It's all controlled neurologically. Well, also, our hormones, our emotional health is also under neurological control. The healthier our body is, the better that our body functions, the better our mental outlook and our mental health will be. Now, we know there's plenty of stress, and especially in a modern stressful age, we're constantly under both physical, chemical, and emotional stress. So the stronger our body can be, the better functioning our body can be, the better our mental health and our mental outlook will be. Now, what's the real connection? The connection is what's the function of both your posture and your spine and your nervous system, and how does the spine and the nervous system control the body's functions, and that's the connection between mood and posture. All right, let's take a look at this. When we look at the spine from a front view, we're supposed to be straight this way. When you look at the spine from the side view, we're talking about posture now. When you look at the spine from the side view, we're supposed to have 3 slow sweeping curves. So we should have a neck curve like this, a mid-back curve, and a low back curve. When the spine is structured like this, straight from the front view and curved from the side, our body's in its best upright posture. Then when we're like that, the body's strong, posture's upright, but most importantly, the nerve system, the brain, can send normal strength and energy down the spinal cord out each of these nerves to every cell in our body, controlling all functions like digestion and heartbeat, but also endocrine control, hormone control, and all just how is our body functioning. So if we have different stresses in our spine, different stresses where vertebrae can misalign out of their normal position, those problems are called subluxations. And what happens is the vertebra misaligns and it puts stress on the delicate nerve. So the brain can't get a signal past there. There's an interference. That subluxation shuts down the flow of energy in the body and causes the body to function less optimally. But if through certain chiropractic techniques, we can correct that subluxation, realign the spine, fix the posture, then the flow of energy from brain to body and body to brain can be reestablished and the body heals. The connection between our mental health and our overall well-being is well established and is continually reiterated in the research. 1997, they did a large chiropractic research where they evaluated how did people do not just with pain, but more how did they answer feelings of like general well-being, emotional health, less anxiety, less depression. All of these factors were improved with chiropractic care. And it was interesting. In that study, they said the longer that people were under care, 1 year, 2 years, 3 years, the better the effects were. So they described it, there was no ceiling to this, that the healing of the body, the repair of the body keeps going so long as we get the stress off the nervous system and then keep it off as a lifetime lifestyle. Like we care for our spine in the same way we'd care for our teeth over a lifestyle. If you take the stress off the nervous system and you keep it off, then the body can heal. And not only do we get rid of things that were more commonly associated with chiropractic, like getting rid of low back pain, but we can have a dramatic effect on the way that our emotions function, our general sense of well-being. That's how it works.